It will no longer be necessary for government to instruct people to work from home, so employers will be able to start planning a safe return to the workplace. There will be no COVID certificate required as a condition of entry to any venue or event, although businesses and events can certainly make use of certification, and the NHS app gives you a COVID pass as one way to show your COVID status. With over 45 million adults now having received a first dose and 33 million a second. That is a higher proportion of the adult population of any European country except Malta. And our expectation remains that by July 19th, every adult will have had the chance to receive a first dose and 2/3 will have received their second dose. And the second reason we paused was because we wanted a bit more time to see the evidence that our vaccines have helped to break the link between disease and death. And as the days have gone by, it has grown ever clearer that these vaccines are indeed successful, with the majority of those admitted to hospital unvaccinated. We will reinforce our vaccine wall, reducing the dose interval for under 40s from 12 weeks to 8, so that everyone over 18 should be double jabbed by the middle of September, in addition to our autumn programme of booster vaccines for the most vulnerable. We will continue from step 4 to manage the virus with a test, trace and isolate system that is proportionate to the pandemic. You will have to self-isolate if you test positive or are told to do so by NHS Test and Trace. But we're looking to move to a different regime for fully vaccinated contacts of those testing positive, and also for children. And tomorrow, the Education Secretary will announce our plans to maintain key protections, but remove bubbles and contact isolation for pupils. Fourth, from step 4, we will maintain our tough border controls, including the red list, and recognising the protection afforded by 2 doses of vaccine, we will work with the travel industry towards removing the need for fully vaccinated arrivals to isolate on return from an amber country, and the Transport Secretary will provide a further update later this week. Last, we will continue to monitor the data and retain contingency measures to help manage the virus during higher risk periods such as the winter. But we will place an emphasis on strengthened guidance and do everything possible to avoid reimposing restrictions with all the costs that they bring.
I think at the moment, the data are not really clear. I think we are confident that because the vaccines prevent people from getting COVID in a very high proportion of cases, that of course is a protection against long COVID, which is itself several different syndromes, almost certainly. And if lots of people are vaccinated, that reduces the risk of transmission in the community. It's one of the reasons why, as the Prime Minister said, vaccinating yourself protects yourself, but also those around you. So that also helps protect. But we do not yet know whether those people who have been vaccinated and then get COVID, whether it weakens or breaks the link between that and long COVID. And I think that those data will come out over the next few months. What we're really trying to work out at this point in time is the relative protection that the vaccines provide for children, but I think we're very confident that vaccines would protect children to a high degree. But the second thing you need to know with all vaccines is about safety, and this is the question that JCVI are rightly taking time to make sure they get all the data before they give final advice. Because for any vaccine, what you want to be confident of is that the benefits of the vaccine outweigh any risks of the vaccine for the children involved. And this will be true also, obviously, for adults. Because children have such a much lower rate of severe outcomes from COVID, and this is one of the few good things with COVID, They have a very much lower rate of poor outcomes, with the exception of a small number of children who've got things like neurodisability. Therefore, we would need to have even greater confidence about the safety, because the risk-benefit is potentially therefore going to be more marginal.
And just a reminder, masks are most effective at preventing somebody else catching the disease from you. They have some effect to prevent you catching it as well. And the situation you're most likely to catch COVID in is indoors, crowded spaces. So that's the obvious place where mask wearing becomes an advantage.